Hi, my topic is Ezetimibe addict to statin therapy after acute coronary syndrome. English medical. Definition. Reducing LDL cholesterol to the recommended levels should be one of the goals of the treatment after and acute coronary syndrome. In this context, high-potency statins are the cornerstone of the treatment. Ezetimibe effectively reduces LDL cholesterol levels. However, it is not known whether this reduction is associated with clinical benefits after an acute coronary syndrome.
Ezetimibe and simvastatin is a prescription medication used in combination with diet to treat high cholesterol. It is a combination product that contains two medications, ezetimibe, a cholesterol absorption inhibitor, and simvastatin, an HMG-CoA reductase inhibitor. This medication comes in tablet form and is taken once a day in the evening. It can be taken with or without food. Common side effects include headache, muscle pain, and diarrhea. Take this medication only as directed. For more information, download the RxWiki mobile app.
Application in medicine. The buildup of the cholesterol and fat on the inner walls of the blood vessels and process now of the arteriosclerosis reduce the blood flow, the which degrades oxygen supply to the heart, brain and the other parts of the body. Reducing cholesterol and the fat levels in the blood might help reduce the buildup and reduce the chances of heart conditions such as angina, chest pain, stroke, and heart attacks.
Treatment with statins reduces LDL cholesterol and lowers the risk of cardiovascular events. The IMPROVE-IT trial was designed to see whether the addition of ezetimibe, a drug that decreases intestinal cholesterol absorption, reduces cardiovascular events even more. 18,000 patients hospitalized after an acute coronary syndrome were included in the trial. Participants were randomized to either simvastatin plus ezetimibe or to simvastatin plus placebo. At the start of the trial, mean LDL levels in both groups were 94 milligrams per deciliter. During the study, the median time-weighted average LDL was 70 in the simvastatin placebo group and 53 in the simvastatin ezetimibe arm. The primary efficacy endpoint was the time to death from cardiovascular disease, major coronary event, or non-fatal stroke. At 7 years, Kaplan-Meier event rates for the primary endpoint were 32.7% for simvastatin plus ezetimibe and 34.7% for simvastatin plus placebo, a statistically significant 2% absolute risk reduction. Approximately 50 people would need to be treated for 7 years to prevent one event. No differences were observed in cardiovascular or all-cause mortality, and there were no significant differences in the pre-specified safety endpoints. In this trial, then, ezetimibe provided incremental LDL lowering when added to statin therapy and modestly improved cardiovascular outcomes. Full trial results are available at nejm.org.
Pros and cons. Pros. Combination therapy, the Wigestat and the ezetimibe is based on the different and the complementary mechanism of action of the two drugs. Statin inhibits the enzyme the HMG-CoA reductase, which limits cholesterol synthesis, and the ezetimibe inhibits the absorption of the biliary and the dietary cholesterol into the intestinal debris through the interaction with the NMP-C1 like-1 protein, thereby reducing cholesterol reaction in the liver. Consequently, there is the overexpression of the hepatic LDL receptor, resulting in increasing the LDL-C fluorescence from the blood. Cons, reasonable uncertainty currently persists regarding the clinical utility of the high-intensity therapy for elderly patients.
Ezetimibe is a prescription medication used to treat high cholesterol when diet and exercise alone are not enough. Ezetimibe belongs to a group of drugs called cholesterol absorption inhibitors, which block absorption of cholesterol from food in the digestive tract. This medication comes in tablet form and is taken once daily with or without food at the same time each day. Common side effects include upper airway infection, diarrhea, and joint pains. For more information on this medication and all other medications, explore the RX Wiki Encyclopedia on the web or on your mobile device.
Yusuk applied in Ecuador. The improved reducing of the common Victorian Efficacy International the trial evaluated the effect of the high-intensity lipid lowering treatment with dexamethasone combined with simvastatin compared to simvastatin and placebo among the patients with stabilized coronary syndrome and observed that ezetimibe added to statin therapy gradually reduced LDL-C cholesterol levels and improving cerebrovascular disease outcomes. Conclusion. The addiction of the exercise to a standard therapy represents an important alternative to consider for the achieving a more intense lowering of the lipid levels in elderly patients who they have difficulty tolerating higher doses of the statins.